Hello dear student, myself Pawan Wankhede going to deliver a lecture on topic Pharmacoepidemiology. Today we discuss regarding introduction, definition and scope of pharmacoepidemiology. So first, what do you mean by epidemiology? Epidemiology is the study of distribution and determinant of disease in population. Means it is the study of distribution and determinant of disease in population. Now, what do you mean by epidemic? Epidemic is the study of chronic infectious disease in large population. Hence, pharmacoepidemiology means it is the application of principle of epidemiology to drug effects and drug use. Hence, pharmacoepidemiology is the study of use of and the effect of drug in larger population. Means the pharmacoepidemiology is the study of use of the drug and its effect of drug in the larger population called as the pharmacoepidemiology. It involves the examination of single individual or large group of people followed by many years. It involves gathering, analysis, of information in order to identify possible causation and related factor that can be applied to clinical practice to a group of people and also individual undergoing treatment. Now we'll see the origin and evolution of pharmacoepidemiology. Adverse drug reaction of drug were are old as modern pharmacotherapy, which was developed in 20th century. Drug resistance, drug abuse, variation in rate of clinical effectiveness were the other therapeutic problem which emerged. In 1961, the case report of maternal use of thalidomide. It is the anti-thyroid drug with malformation of offspring result in awareness of potential of drug to cause adverse drug reaction. If this thalidomide drug is given to the pregnant woman, it causes the teratogenicity and hence it causes the malformation of offspring. In 1961, it is known. Since then, the greater attention was focused on detection, prevention, and management of adverse drug reaction, and the era of pharmacoepidemiology has begun. The importance of adverse drug reaction detection through this system include gray baby syndrome due to chloramphenicol. Chloramphenicol, it is the antibiotic when this chloramphenicol given to the babies due to the enzyme is not developed and hence it causes the accumulation of chloramphenicol and causes the syndrome gray baby syndrome. Next, it is the vaginal cancer of offspring of woman to diethylstilbestrone during pregnancy. If it is the it taken the drug diethylstilbestrone during pregnancy, it causes the vaginal cancer. Isotretinoin induced birth defect. Isotretinoin, it is a vitamin A derivative which is used in treatment of acne, which causes the birth defect. Triazolone induced CNS depression, suicidal ideation of fluoxetine, which is an antidepressant drug, death with phenterol. Phenterol, it is the beta-2 sympathomimetic drug used in treatment of the asthma. Venous thromboembolism with oral contraceptive. Now, the International Society of Pharmacoepidemiology was formed to obtain more data on risk and benefit of drug in population and to discuss and develop and disseminate information about pharmacoepidemiological method. In the 1960, the related AI field of drug utilization was developed along the study of adverse drug reaction. As a result of wide variation in the pattern and extent of drug prescribing, growing concern about adverse reaction and cost of the drug, the pharmacoepidemiology method were developed. According to the WHO, DU is the marketing, distribution, prescription, and use of drug in the society with special emphasis on resulting medical, social, and economical consequences. Now we'll see the need of pharmacoepidemiology. Lack of alternative model to investigate some drug event. Example are to evaluate teratogenic effect of a new medicine. Why there is a need of pharmacoepidemiology? Because there is a lack of alternative method to evaluate the teratogenic effect, means effect of uh, offspring due to the drugs. Clinical trials are inadequate to answer questions about drug safety as they are lack adequate statistical power. If all the adequate of for establishing effectiveness, the sample size of are inadequate to detect the less common adverse drug reaction. Clinical trials are conducted on highly selected patients without any comorbidities and who taking no other medicines. Clinical trials are conducted on highly selected patient without any comorbidities. Comorbidity means the patient is suffering from other disease or disorder or not. Clinical trials does not involve elderly, pediatric, or the pregnant patient. The clinical trials is does not involve elderly, pediatric, small baby, or the pregnant patient. Clinical trial investigate the single indication. Hence, clinical trial fail to provide the adequate information related to safety and efficacy of drug under non-trial condition and in other indication. In contrast, pharmacoepidemiological model provide alternative approaches to evaluate the drug effect. Now see the aims of pharmacoepidemiology. First is signal generation, identification of subtype, serious adverse drug reaction, also help to detect new application of the drug. Example, minoxidil is used as an antihypertensive and hirsutism. Minoxidil it is the potassium channel opener drug used in the treatment of hypertension. Minoxidil has the side effect called as the hirsutism, means increase in the hair growth, and hence it is used in treatment of the baldness. Risk quantification. Pharmacoepidemiology model can be applied for risk quantification, which may cause the rule of three. Indicate if an event occur in one of every 5,000 exposed patients, 3 into 5,000 people would be needed in a sample of 95. Hypothesis testing. It requires the use of comparison group to determine whether there are differences in variable of interest. Application of pharmacoepidemiology. Estimation of risk of drug use. The drug involved in the drug, the risk involved in the drug use can be quantified. Means how the risk it is involved in the drug it is quantified. The benefit and risk of use of drug may be weighed. Estimation also help to identify risk situation. Example are case report of triazolone induced psychotic disturbances appeared soon after its introduction into the market. The triazolone, it is the antipsychotic which are used as antipsychotic drug. um, Induced psychiatric disturbances appeared to soon after introduction to the market. The drug are withdrawn in some countries. The reaction was likely due to dose related, hence the problem was abated by some time in lower doses. Use in patient counseling. Collection and analysis of observational data from other studies may help to address certain issues through counseling the patient. Example are pregnant woman may wish to terminate pregnancy if there is a substantial risk of producing a serial malformed child, but would also wish to proceed with the pregnancy if the risk is low. This is the use of patient counseling. Formulation of public health policy decision. Quantitative as well as quantitative information from pharmacoepidemiology studies help to address the many issues. Example, if an inappropriate prescribing is observed among the prescriber, regulatory agency may require educational intervention and may impose restriction on specific drug or the practitioner. Pharmacoepidemiology study also helps in policymaker to assess whether a drug should be withdrawn from the market or allowed to remain. Next, it is a facilitation of pharmacoeconomics evaluation. Data from pharmacoepidemiology study can be used to measure the effect of drug on overall care host and resource consumption. Example, hospitalization due to serious adverse effect of drug leads to more expenses as well as resource consumption, which could be avoidable. This is the application of the pharmacoepidemiology. I hope all the students understand this topic, pharmacoepidemiology. Thank you.